A few years ago, a story crossed my path that completely changed how I think about medical decisions and what it truly means for a treatment to be successful. It involved a woman I'll call Barbara, a 72-year-old who was active, independent, mentally sharp, and living the kind of life many people hope to enjoy well into their later years. She managed her own affairs, stayed socially engaged, and valued her ability to move freely and care for herself. When Barbara was advised to undergo a knee replacement, she was understandably nervous. However, she was reassured that the procedure was common, routine, and expected to restore her mobility. Like many patients, she focused on the promise of a better future and trusted the experts guiding her care. What followed was something no one had fully prepared her family for. The operation itself went according to plan. From a technical standpoint, everything appeared successful. Yet recovery became complicated. One medical issue led to another, creating a chain reaction that gradually transformed a straightforward surgery into a months-long struggle. Instead of returning home and rebuilding her strength, Barbara found herself facing serious setbacks that affected nearly every aspect of her health. The procedure succeeded on paper, but her overall outcome told a very different story. That experience highlights an important truth many people never hear. A successful surgery and a successful patient outcome are not always the same thing. Here at Vital Aging, we believe this distinction is especially important for adults over 50. As we age, the conversation about surgery becomes more complex than back pain is one of the most common reasons adults over 50 seek medical care. It can affect sleep, mobility, exercise, independence, and overall quality of life. When pain persists for months or years despite treatment, many people eventually find themselves sitting in a specialist's office discussing spinal fusion surgery as a potential solution. Spinal fusion is a procedure designed to permanently join two or more vertebrae, reducing movement in a section of the spine that may be contributing to pain. In certain situations, particularly when there is significant instability, nerve compression, or structural damage, the procedure can provide meaningful benefits. However, not every case of chronic back pain fits that description. One of the biggest concerns is that many patients assume surgery is the next logical step simply because other treatments have not produced immediate results. In reality, chronic back pain often responds best to a comprehensive approach that includes physical therapy, targeted exercise programs, weight management, posture correction, pain management techniques, and lifestyle modifications. These strategies may require patience, but they can produce significant improvements without permanently altering spinal anatomy. Unlike many non surgical treatments, spinal fusion cannot be undone. Once the vertebrae are joined, that change is permanent. Additionally, the procedure can place extra stress on nearby areas of the spine, potentially creating future problems that require additional treatment. At Vital Aging, we encourage anyone considering spinal fusion to carefully evaluate whether all reasonable non surgical options have been explored thoroughly and consistently. A brief attempt at therapy is not the same as a structured, comprehensive rehabilitation plan. Before agreeing to a permanent procedure, make